Hello, everyone, and welcome virtually to the Sonata Patient Education event with Dr. Slatter Hall. My name is Teresa. I'm the nurse advocate and educator for Sonata, and my co-monitor is Casey, and she is with marketing. I want to welcome Tapresha Norris, our patient advocate, as well as Dr. Slatter Hall this evening. One of our main goals is this event is meant to be an open conversation. So feel free to ask any questions in the chat or share your story with the group. This is meant to be interactive, and so feel free to be comfortable and share your story. Dr. Slatterhall, can you tell us a little bit about yourself?
Yes, good evening, everyone. Thanks for joining us. My name is Dr. Miriam Slatter. I am an OBGYN board certified practicing here in Paducah, Kentucky. I've been here since 2015, August, so nearly 9 years next month. And prior to that, I was working in academics at Grady Hospital in Atlanta, Georgia, and that's where I trained as well as practiced for several years. So those are the basics.
Okay, perfect. Well, let's begin this evening. Let's talk about fibroids.
Absolutely. We'll go ahead and get started. We have a small presentation. We'll have a little video here we're going to play for you, and then we'll get into it.
Most fibroids are asymptomatic or without symptoms. For the women that do have symptoms, the symptoms are heavy menstrual bleeding, low pelvic pressure. You could have problems with urination, constipation.
I first started having symptoms about 7, 8 years ago.
In my early 20s.
Probably 8+ years ago.
4 years ago.
When I first started my cycle at age 14, and they were always horrible.
And some of the stories that women have communicated to me have been otherworldly. They really modify their whole lifestyle as a result of their symptoms.
My symptoms got so bad that I actually had to change careers because I could not continue taking days off of work because I couldn't get out of bed.
My symptoms were so bad to the point I will be in the house a week straight.
It was essentially having my period all month long.
When I was taking sick days because I just couldn't get out of bed, painkillers were not helping.
I don't remember a time when fibroids didn't affect me.
My doctors told me that the best treatment would be most likely a full hysterectomy to treat this.
They offered me birth control pills to help with the bleeding.
I went to several doctors looking for an alternate opinion, and I consistently got hysterectomy being my only option.
Hysterectomy or myomectomy, I believe, is the other option she gave me.
A hysterectomy was my only option.
A hysterectomy. And then they suggested I could take some birth control pills.
Minimally invasive hysterectomy, your recovery is 3 to 4 weeks. If it's done open, it's a 6 to 8 week recovery.
I thought a better option would just be to deal with the symptoms than to have my body parts removed.
There were not any treatments for it.
The Sonata treatment is for women with symptomatic fibroids who want to preserve their uterus and avoid major surgery.
After my Sonata treatment, I saw relief. I wasn't having constant periods every single day.
It just started getting lighter and lighter.
I say about a 75% reduction from what I was used to.
I do not suffer from the pain, the cramping, or the heavy bleeding like I did prior to the Sonata treatment.
I don't have to worry about going anywhere when I'm have my period. I don't have to worry about if it's going to be an incident like before.
The procedure takes less than an hour typically. Recovery is a half hour to 45 minutes before you're discharged and ready to go home.
I no longer have to carry an extra change of clothes. I don't have to keep anything on my mattress.
You have a chance to actually have this treatment and know that your life can be so much better.
Absolutely, hands down. Investigate it, check it out. I would look at it as a first option.
I know this sounds weird, but I can wear white pants and not be nervous about it.
I would definitely tell them to try the Sonata.
The Sonata treatment is very effective. 95% of the women have a reduction in menstrual flow after 1 year, and 97% would recommend it to a friend.
Look into the Sonata process.
Just give it a chance.
It's a game changer.
I never got to wear tampons before. I can wear tampons now. I believe it's the way to go.
Very good. Okay, so those are just some samples of stories of women who've actually gone through the procedure. And we have our own patient that's going to give us her story as well. Let's just get started with kind of like the basics. Fibroids, we use that term, and most patients want to know, exactly what is a fibroid. And typically, the way that I will describe those, Casey, you can go ahead and pull up that next slide, is that they are benign tumors, and they really are like balls of muscle and fibrous tissue. They can live anywhere in the uterus. Next slide for me. And we classify them based up on where they are located. So we have submucous fibroids. These fibroids are going to be fibroids that are next to the uterine cavity. Actually, would you go back one, and I can, so that our participants can see it. Awesome. So when we look at the uterus, this is the wall. The wall of the uterus is that light pink tissue. And then the cavity where a baby lives if you're pregnant. Yes, thank you. Of the uterus. That tissue that lines the cavity of the uterus is the tissue that grows and sheds and bleeds every month. And so fibroids that live next to that particular tissue, those are called submucous fibroids. You can have fibroids that live fully within the wall of the uterus. Those are called intramural. And then you can have those that live kind of nearer the surface of the fibroid. Those are called subserosal. I mean, you also have fibroids that actually dangle off of the uterus. And depending upon the location of the fibroids, you can experience different symptoms. So we'll go to that next slide. Those fibroids that are near the cavity of the uterus usually are those fibroids that are going to cause the heavy menstrual bleeding, the clotting, that type of thing. Those that live in the wall, you can have more frequent bleeding, irregular periods and bloating. And those that live more towards the surface can cause bloating and discomfort. And the other thing I will say is typically just because where the uterus lives, in its neighbors typically are going to be the bladder to the front and your intestines to the back. A lot of patients will experience changes in urination, either increased frequency or sometimes even constipation. We'll go to our next slide. So how often does this occur? Fibroids are very common. Nearly 70% of women, white women in particular, will experience fibroids. And African American women will almost, some numbers will say up to 3 times more, but around 80% of African American women will experience fibroids during their lifetime. They are more common during your fertile years or your more reproductive years. So you can develop those and usually grow those up into about the age of 50. Every fibroid does not cause symptoms. And just because someone feels the fibroid on exam or says that you have a fibroid on ultrasound, it doesn't mean that you require treatment. So generally the way that I think about it and will advise my patients is that if they are not bothering you, you don't have to bother them. We can just leave them. But if they are causing symptoms, and about 20 to 50% of women who have fibroids will experience symptoms, then that's when we start talking about intervention. More than 2 million women will undergo some form of treatment for uterine fibroids, and that can range from medication to surgical intervention. And kind of usually the next question is, why did I get these? Honestly, there is not a real good explanation. We don't have like an exact formula, but we do know that there does seem to be some pattern of heredity. And so if your mother or your sister had fibroids, you have a good chance of having fibroids at some point during your lifetime. Okay, we'll go to the next slide. So how do you know you have fibroids? If you're having very heavy periods, and kind of my gauge for this, I'll ask patients, on your heaviest day of your cycle, what are you using? Are you using pads or tampons? Are you requiring a combination of those? If you are having to change your sanitary products more than every 1 to 2 hours, or more frequently than every 3 hours, I'll say. So if you're changing a pad or tampon every 1, every 2 or less hours, then that we consider to be heavy bleeding. A prolonged period, and that for me is going to be any bleeding longer than 7 days, very painful periods. We expect you to have some cramping during a period that should be able to be controlled with ibuprofen or Tylenol, and get some relief. But if you are surviving on those medications around the clock during your menstrual period, that's not normal. And then if it's causing interruptions in your life, so missing work, can't get out of bed, don't want to be involved in family activities, or can't leave the house, then those are the ways that these usually will impact you. Other things, pelvic pain, and then one that's not listed is pain with intercourse. We typically suspect based on symptoms that you have a fibroid. We can also usually detect some changes in your uterus on pelvic exam. So when you come in for your annual exam and we do those vaginal exams, those are some of the things that we're feeling for the size and shape of your uterus. And if your uterus feels larger or abnormally shaped, then those can be indicators that you may have fibroids. So one of the things that's really interesting, just like the lady said in the video, is that most women have either been experiencing these abnormalities or changes in their period for so long that they think it's normal, and that's something that they just have to deal with. And they've seen their mom and their aunt and their sister deal with it, so this is just what a period should be. And so most women wait 3 or more years before they actually will reach out for help. And then once they reach out for help and they get some of the responses as to how to address it, many women will not choose a treatment because of those treatment options. A lot of women want to preserve their uterus. They don't want to have a major surgery. They can't, they don't want the longer recovery times. And so they will just opt to, like the patient said in the video, just to do nothing. So what are some of the options that we have to treat fibroids? There are several choices, typically depending upon the severity of the symptoms. If we go to the next slide, a lot of docs will start with medical management that can be in the form of birth control pills. We also have different medications now that can kind of interrupt that signal between the brain and the ovary to control the frequency of bleeding. And then once we have tried medical management, we move on to the procedural types of things. We can do myomectomies, and all myomectomy means, because we call fibroids, their technical term is myoma. A myomectomy just means that we remove surgically the fibroid, and this can be done depending upon the location, either hysteroscopically, which is shown in that second step there, where we place the camera into the uterus, identify the fibroid, and resect it that way. We're going to skip down to that orange slide. You can do it laparoscopically, or with small incisions, or a larger incision called an open myomectomy, where we go in and actually make incisions on the uterus and remove the fibroid surgically. There also is a minimally invasive procedure called a uterine artery embolization. And this is where a radiologist will find the blood supply to fibroids by threading a catheter through the largest vessels of the leg and then just tracing that blood supply to the individual fibroids and blocking that blood supply off. And then kind of what we consider to be definitive management, or the thing that we know will stop fibroids. You'll never have another fibroid, but fix the problem permanently, is a hysterectomy. And those are the options that we've had up until this point. and this is where we what brings us to the conversation tonight is Sonata offers us a different route of treatment. You can see as Casey kind of flashes through, all of these treatments have some side effects, they have some benefits. The recovery times are different, and for various reasons, patients can tolerate those, can't tolerate those, or will have tried many of those things, and get to the point where we say, oh, well, the only thing that we have left is a hysterectomy, or which is removing the organ. But Sonata offers us an alternative option where we don't have to make any incisions. Your recovery time is very short. So usually what I'll tell patients is, the way we do it here at our facility, we do use anesthesia. So once you have recovered from anesthesia, which usually just takes the evening, you can resume your activities the next day without any restrictions. We don't have to really make incisions on your uterus. And so some of the things that come with that, scar tissue, longer healing time, bleeding, and more pain, we can avoid all those things. Even though we do these in the hospital here currently, that's how we are set up now, and we do anesthesia. This is an outpatient procedure, so you do not have to spend the night in the hospital.
Dr. Slatter Hall, I do have a question. What is the typical anesthesia used during the Sonata treatment?
Right now, we are using general anesthesia. So what that means is you come in, you get an IV, and we put medications in your IV that will allow you to fall asleep and not experience or be awake during any bit of the procedure. I always kind of liken it to a lighter anesthesia because you're not paralyzed. Like there are different grades of anesthesia, but you're not paralyzed. You can still breathe on your own, but you won't remember or feel any bit of the procedure.
Yeah. And I have an additional question. Will this require an overnight stay, or will I go home the same day?
You go home the same day. So what we do is once we've completed the procedure, you wake up in the operating room. We'll take you to the recovery area, and you're there about 20 or 30 minutes until you're fully awake. And then we get you ready to go home. So your recovery usually anywhere between 30 minutes to an hour, depending upon how you respond to the anesthesia. Any other questions? It's a good place to pause.
Yes, I do have another question. Who performs the Sonata treatment?
I do. So your physician will perform that. And we have some pictures, I think, coming up that will kind of show you what I do during the procedure. So once you are asleep, and we drape you, we put some pads on your legs to help with the energy that we use. We get you in position kind of similar to that of having a pap smear, and then we place this handpiece through the cervix into the cavity of the uterus. And this is an ultrasound. And with this ultrasound, we are able to locate the fibroid and measure it, get a good measurement and where it's located. We make sure it's in a safe place for treatment. And then once we are feeling good about that, then we will deploy these needles that go directly into the fibroid. So what they're showing here is just sizing. This is going to determine how much treatment this individual fibroid gets and for how long that treatment will last. We anchor the device into the center of the fibroid. We want to be as central as possible. And then we check again. So what we're checking for again, because your uterus has these neighbors, your bowel and your bladder, we don't want to injure those in any way. We want to make sure that we are safe from those things, but also that we're not destroying too much tissue. We want to leave behind the good tissue. You see that those needles are then deployed. And again, we make sure, are we safe? Is this on good? And can we preserve as much normal tissue as possible? And then based on those measurements, the machine comes up with a total treatment time. And then that radio frequency is engaged. And usually that's anywhere from about 1 to 3 minutes or so, depending upon how large the fibroid is. And then once it's done, we remove everything. So over time, that fibroid usually will get smaller in size, and because it's getting smaller in size, then you should notice within about 3 months that your symptoms will improve. Now, we're not suggesting that you would have, you're still going to have periods, but what you should notice is that the flow is lighter, and that the pain that you experience during menstruation or just throughout the month, just from the bulk of the size of the fibroids pressing up on its neighbors, that you should notice an improvement in symptoms at about that 90-day mark, most
Okay.
significantly.
I have a question, Dr. Slatter Hall.
Mhm.
This particular patient was told she couldn't have an ablation because my C-section scar was too thin. Would I qualify for Sonata?
That's an excellent question. It really, yes, absolutely. Depending upon where your fibroids are located, yes, that would not be a barrier because with an ablation, that's more of a total, we can't isolate a particular part of the uterus that we're treating. As opposed to what you saw in that video with the Sonata, we are only treating that individual fibroid and we are avoiding any other tissue that's around it. So absolutely. Great question.
And I have another question. Is the Sonata treatment painful?
I would say yes, you can in the sense that you can expect to have some mild cramping. That's the most common report that I'm getting from patients. So it's not pain-free. It's not, I don't know anything that any intervention that we have that's pain-free. But again, you're asleep during the procedure, and then post-procedurally, what you can expect to have is cramping at most. Okay.
I also have a few questions coming in.
Love it.
This particular woman went to the ER today, has fibroids, she has a heavy cycle, and she's interested in looking into the treatment. What I do suggest is there's a link in the chat that you can schedule a consultation or go to sonatatreatment.com and talk to a nurse, and we can get you hooked up with Dr. Slatter Hall for a consultation.
Absolutely. Okay.
I have another question if you're up for it.
Absolutely.
Okay. This particular woman has a few fibroids hanging in the middle of her uterus, intercavitary. Will the Sonata treatment be able to get to them?
Yes. And so absolutely the device actually is in the cavity, and regardless of where those fibroids are located. Now, the fibroids that we can't treat are those fibroids we mentioned earlier that are hanging off of the off of the uterus. So they're attached, but by like a stalk, that we're not going to be able to treat those. But if they are in the uterus, typically we're able to treat those. Again, making sure that that we're not going to affect any of its neighbors. But if it is in the wall or cavity, the majority of the bulk of those fibroids in the wall or in the cavity, yes, ma'am, we can treat those. Just briefly, as those questions continue to come in, what I do want to highlight is that while this treatment is new to our area, and it's kind of, we're rolling it out in the country, to be quite honest, more than 8,000 women have been treated with Sonata, and that includes women both in the United States and Europe. We've got over 50 articles published in medical journals. And what I will say, one of the ways that I was kind of got on the Sonata train was our governing body of obstetricians and gynecologists do support this treatment. Being able to offer women something that is non-invasive with good recovery, with quick recovery, And the ability to conserve the uterus, guys, this is a game changer, particularly for, African American women who are usually affected earlier in life with these symptoms. So in their 20s and their 30s, we're talking about women who have not yet had babies, any of those things, you know, and we're telling a woman to get a hysterectomy. And while there are some, caveats to that, um, we can preserve the uterus. Even if you're 50, right? And you're still having menstrual periods and you want to leave here with all the organs that God gave you, I respect that. You absolutely have the right to do that. This allows us the option to do that.
An additional question. What are the side effects, if any?
Um, Side effects really, like I said, really are going to be in those first several months, the cramping. Um, Really the biggest side effect we hope that you experience is a decrease in your symptoms. The other thing I will say now, one of the things I am finding just here is that immediately post procedure, we have a lot of women that will experience some really intense nausea and vomiting. But that's only in the hospital, and prior to you leaving, we're able to take care of that, and that may be a result of the anesthesia. Or anytime we manipulate the cervix, it can be nauseating.
Okay.
Okay, so just gonna go over this slide really briefly. About 50% of women are able to return to their normal activities the next day. 95% of women had a reduction in their bleeding after 12 months when they were followed up, and more than 90% were followed or that were followed were satisfied with their treatment after 3 years. And then even when we looked at them 3 years out, they were still experiencing improvement of their or improved menstrual symptoms. And let's see. So there are a few reasons why we wouldn't do a Sonata. Of course, clearly, if you're pregnant, if you have an active pelvic infection, if you have any other known or suspected malignancy or cancer, be it of the cervix or the uterus or a pre-malignant condition like a endometrial hyperplasia, we don't want to do that. If you have previously had sterilization with coils in your fallopian tubes, that Easter procedure, which is rarely done anymore, but there are patients who are out there who had that done, we don't want to do that. Or if you actively have an IUD device, we would want to remove that prior to treatment. I think the elephant in the room we always have to talk about, another big question I get is, can I get pregnant after having the Sonata procedure? We do have more and more data that is rolling in that women who have been enrolled or who have undergone the procedure, there are many, many women who have successfully gotten pregnant. But we don't have enough data, and when we're in the medical community and academics, before we can recommend that you have this procedure, if you're wanting to retain your ability to have or to be pregnant. What we will say is though that if you don't want, the way I say, if you don't want to close the door, if you're not ready to close the door and leave the door open for the potential of having babies in the future, this option is still available. Risk of the procedure. I'm sorry. There are risks of the procedure. So bleeding, anytime we introduce something into our body that God didn't send us here with, I tell you there's a risk of infection. The nausea and vomiting we talked about. Some women, particularly if we are having to treat a lot of fibroids, will experience some sloughing, or where that tissue that has died, for lack of a better word, may shed. And so you may have tissue pass during your period or even in between periods. And then the biggest concern being, other concern being that we can injure nearby organs. That's why we do so many of those checks to make sure we're not near organs, the neighboring organs nearby. And I think we're about at the end. Yes. Any other questions or concerns?
Nothing right now. Thank you, Dr. Slatter Hall. Let's move to Prisha. Prisha, would you like to share your experience and your story with the group?
Yeah, I would. So my symptoms started happening the beginning of last year. The symptoms that I had was a lot of pressure in my pelvic area. I was very bloated and I had severe cramping. At the time, I did have an IUD placed, and so I had an issue with IUDs before, which my body rejected. So I was assuming that maybe that's what the issue was. So I had called my doctor and let her know, like, hey, I feel like I'm literally going into labor, like something is not right. And so she told me to come in to see if maybe my body was rejecting my IUD. And so she got me in the room, and she was trying to pull it because she said, it sounds like your body's rejecting it. But she kept pulling at it and it wouldn't come out. So she asked for an ultrasound machine. And when she got it, she was like, did you know that your uterus is full of fibroids right now? And I was like, no, I had no idea that I had them. Um, and she was like, yeah, your IUD is even stuck on one. So I had to have a surgery to get it removed. And so a week later, I had that done to get the IUD removed, and I was just fine. One day I'm at the grocery store checking out, and all of a sudden I start pouring out blood everywhere. And I'm like, what the heck is going on here? I call the on-call doctor and they told me to come to the emergency room. They did an exam and everything, and they said that my fibroids were probably irritated because of when she went up in there to take the IUD out. And so they had brought up the procedure to me to have it done. But at the time, the insurance that I had wouldn't cover it. So I had to go to a different doctor. And the only other options they really threw at me was a myectomy or a hysterectomy. And those were two of the things I really didn't want. I didn't want a myectomy because I knew I'll be out of work for a long time and it'll be a long healing process. And I didn't want to have a hysterectomy because I still wanted to keep the door open for having children. So I had to go to quite a few different doctors to get different options, and I was just hitting a wall. I wasn't getting anywhere. Then I eventually had a change in insurance, and then I met my doctor again, and she's like, well, I see that your insurance changed. Let's try to see if we can go ahead and have the procedure done. My insurance approved it, and then 2 days later, I went and had the procedure. You go in that day, they get you hooked up as an IV and everything, and they put you to sleep. Um, and then you wake up a few hours later. I had a little bit of pain, but not bad. It was just mild cramping. I took some Tylenol, and then the next day I went about my day. Everything was normal. Ever since I've had that surgery, I basically have my life back. I used to have to carry around a backpack full of extra clothes. I would literally have to leave work to shower to come back to work because I bled all over myself. I used to cancel plans because I was embarrassed that I was going to bleed on myself or I was bleeding on myself. So I pretty much have my life back, and I'm very grateful for that.
Great, great. Thank you, Capricia. Very impactful story, and I'm sure many women can certainly relate to your experience. Any further questions? Does anybody have? Okay, ladies. I want to thank Dr. Slatter Hall for sharing your best practices, your insight, and your experiences with us. I want to also thank all the ladies out there virtually for taking the time to learn more about your options and the Sonata treatment. If you would like to schedule a consultation with Dr. Slatter Hall, there is a link in the chat, or you can log on to the website, sonatatreatment.com, and schedule a Sonata consultation with Dr. Slatter Hall that way as well. Again, thank you for joining us. And on behalf of Gynesonics, everyone have a great evening. Thank you.
Thank you.
Thank you.